Your dog skipped breakfast this morning? Should you panic or wait? Sometimes it's nothing, but there are 3 situations where waiting could cost your dog's life. Your dog walked up to the food bowl, sniffed it, and walked away. Is your dog just being picky, or is this the first sign that something serious is actually happening? Hey Pack, I'm Dr. McCubbin, and after more than 26 years as a veterinarian, I've learned one thing. Pets almost never read the textbook. Today, I'm going to show you 3 signs that tell me whether your dog can safely be monitored at home or whether you need to get in the car and head to the veterinarian immediately. Because a dog that suddenly stops eating isn't just skipping dinner, it's actually giving you information. Your job is knowing when that information becomes an actual emergency. One of the hardest conversations I have is with someone who says, I thought if I just gave him another day, he'd start eating. Sometimes they're actually right, but sometimes another day was one day too many. That's why I made this video. Now, before we get started, every dog is different. Puppies, senior dogs, diabetic dogs, or dogs even with chronic medical conditions. They may actually need to be seen sooner than what I'm about to discuss. In veterinary medicine, we call a loss of appetite anorexia. Now, it doesn't mean what it means in people. It simply means loss of appetite. And it can be one of the earliest warning signs that something serious is happening inside your dog. The first thing a dog usually does when they're not feeling well is they stop eating. So if your dog is this like Lola that eats anything you put in front of her, she's not eating something you offer, something is definitely wrong. So here's how I look at it in the exam room. Number 1, how long has your pet not been eating? A healthy adult dog might occasionally skip one meal. It's hot outside, maybe they aren't feeling themselves, or maybe, like my child, they're hoping that you will offer chicken or something tasty instead of their regular kibble. Some of you know exactly what I'm talking about, don't lie. But once you're approaching 24 hours without eating, that's when I want you to be calling your veterinarian to have that conversation. Not next week, not if they still don't eat tomorrow, I'll call. Now, if we're getting close to 48 hours without food, especially if it's a puppy or one of those little teacup toy breeds or a dog with another medical condition like diabetes, that's an emergency because at that point, they can become dehydrated, their blood sugar may actually be very unstable, and whatever caused them to stop eating in the first place may be actually getting worse while you're watching it and waiting to see. The sooner we diagnose the problem, the better the outcome usually is. Number 2, I don't just look at not eating. I want to know what else is happening. Is there any other sign and symptom that you can tell me that will help me to help you to figure out if it's an emergency or not? Here's where most people get caught. Not eating by itself, sometimes it's not really an emergency. But not eating plus something else, that's when my veterinary brain starts making a list. Not eating and vomiting, now I'm thinking, oh my God, pancreatitis, a stomach or intestinal blockage, kidney problems, or some other serious illness. Listen, I have surgically removed socks, rocks, pieces of corn on the cob, pieces of dog toys, you name it, from dogs whose very first symptom was simply not wanting to eat. Not eating, lying around, not greeting you, not coming when you're calling, not wanting to go for their walk, not wagging the tail, just basically looking poorly. That dog is not just being stubborn. That dog is probably very sick. Not eating, drinking a lot of water, urinating more often. Your cats, you should pay attention. Losing weight, well, of course, by the time you're losing weight, you've missed the ball. Like you should have gone last week. Now, diabetes, kidney disease, hormonal disorders, all of those things can cause your dog to stop eating, drinking more water, and even urinating more. So those are technically higher on the list. Listen, these conditions don't fix themselves. They don't just get better overnight. Your dog likely needs, or cat needs, medical attention. Number three, kind of give you an insight about what's going on in the exam room. So when you bring your dog to me or to your regular veterinarian, here's what I'm checking first. I'm doing a physical examination, of course, and I usually do it in sequence. So I go head, neck, body, abdomen, legs, tail, all of that. But usually the first thing I'm looking at is your dog's eyes and, of course, your dog's gums. Healthy gums should be nice and pink. If your dog is pale, meaning it's like more on the white side, or it's yellow, or even kind of a brickish kind of red, that tells me something serious is going on. I'm also checking whether the gums feel moist or sticky. Sticky gums can be another clue that your dog is actually dehydrated. Then, of course, during the course of my examination, I'm actually palpating the abdomen. If your dog tenses up, cries out, tries to move away from my examination, or even tries to bite because their first instinct is try to bite when they're feeling pain, then I'm thinking about pancreatitis, I'm thinking about foreign bodies, serious business. Finally, I'm going to check the hydration status. I'm going to lift the skin over the shoulders, lift it up gently, and then let it go. If it doesn't return quickly, your dog is more than likely dehydrated already. Dehydration plus not eating, never a combination I'm going to tell you to ignore. Go ahead, pause the video, go and check your dog's mouth. Lift the lip up gently, and if they're sleeping, leave them alone. Do it later. Take a look at the gums. This is one of the simplest, easiest things that you can check at home before you even call the vet to see what you should actually do. That gives you a very good idea. So your dog didn't eat dinner, and you lift the gums and it's pale, ER time. What can you do tonight? So if you notice something like any of what we just discussed before, what can you do tonight? So it's 10 o'clock. Let's paint the picture. It's 10 o'clock. Your regular vet's closed. We close at 6. What should you do? First, don't panic. Try warming some food. So your dog's regular food, obviously if it's kibble, don't warm it, but get a small amount of canned food. Warm it in the microwave, not hot, piping hot now, just warm it. Warm it for a few seconds. Warm food actually smells stronger, and smell plays a huge role in a dog's appetite. Second, check those gums. If they're pale, white, yellow, brick red, like we discussed before, do not wait. Do not pass go. Do not collect $200. Head to the ER right away. Thirdly, if your dog eagerly takes the treats, soft treats like what you get from the canned food, but flat out refuses the hard kibble, that's probably pointing to dental disease, dental pain. Now, that doesn't mean it still doesn't need to be examined, but if your dog ate the soft food without forcing, do not force them, then it's still something that needs to be checked out, but it's likely that your dog is feeling pain, and that can typically wait until the following day. That means your dog's not really lost his appetite, he just can't chew on the hard food. Oh, one more thing. Do not force feed your dog. Do not try to feed your dog if your dog refuses the food. Don't force it down your dog's throat. If your dog is nauseated, or even worse, has some kind of a stomach or intestinal blockage, forcing food can actually make the situation worse. So don't force them. Offer it to them, but do not force it down their throats. Let's talk a little bit about the exam room some more. Let me share something. One of the hardest conversations I have with a client is when someone says to me, I didn't want to bother you, doc. Give me a break. You don't want to bother me? I've literally made it my life's work. Us veterinarians have made it our life's work to be able to help animals. So you're not bothering us when you try to find out if your pet is not doing well or it's something you need to bring them in for. That's literally why we're here. I would much rather examine your dog, tell you everything is fine, you can go on home, everything's cool, both of us can be relieved, than meet you after the illness has become life-threatening and I give you a $3,000 estimate for a foreign body removal that could have been sorted out before your dog got to this situation. So, in closing, let's keep it simple. One missed meal, watch it. 24 hours without eating, call your veterinarian. 48 hours or not eating combined with another clinical sign, do not wait. Go to the ER because I've seen dogs decline incredibly fast and early treatment actually saves lives. Why would you want to take that chance? Tell me in the comments what made your dog stop eating. Was it something simple? Was it something that completely surprised you? Your story might help another pet parent. My goal here is to help you recognize emergencies before they become tragedies. If you want honest, evidence-based veterinary advice every week, subscribe, join the pack. I'm Dr. McCubbin. This is Vet Unfiltered. Walk good.